Good afternoon, everyone, and welcome to today's session. Shivaya, Chandu, and welcome to today's session. Sujana, Niharika, Jagan, and many more who are all online. Please update all your friends that the live class has started. 150 most commons. AIIMS, All India, JIPMER, PGI, and the NEET PG, FMGE. If you take all these question banks together in pediatrics, you ask a computer, Mahoday, please show me what are all the most commons examiner want. The computer has an algorithm built inside it. It will throw out all the questions, most commons involved. So if you take all the 19 subjects together, there are almost 5,000 most common questions, most common based questions. Similarly, there are about some 4,000 questions which are investigation of choice kind of questions. Around another 2,000 questions would say pathognomonic, gold standard, etc. So like that, category wise, if we happen to classify the subject, that is one style of learning to make the learning process interesting. So let's make the great beginning of the today's session, Doctor. Good to see 28 online classmates. Please also invite many other friends who are in WhatsApp, Telegram, Facebook, etc., etc. Now we are roping in almost 150 medical teachers who are very passionate about teaching. You had been watching Dr. Ravi Kiran, orthopedic surgeon. Dr. Pushpa is teaching anatomy. So similarly, we have Dr. Gautam who teaches surgery, Dr. Apeksha, Dr. Shilpa Reddy who teach obstetrics and gynecology. You are going to have many more broadcasts across the day on the YouTube channel. We were free and always free for all of you. But at the same time, I urge you all to take up take an opportunity to subscribe to the video library of onlinembbs.com, and also we have 65 full-scale grant tests and discussions. Online tests are available. So I also invite you to subscribe to the online tests also, right? So that will bring a good shine to your preparation. So let's make the great beginning today. The most common complication of the mumps in children. So the most common cause of the mumps, complication of the mumps, is aseptic meningitis. It is not architis. Architis is the most common mistake done by the students. The most common cause of acute otitis media in children, Streptococcus pneumoniae. The most common complication of mumps in children, don't forget aseptic meningitis. The most common cause of congenital hypothyroidism, thyroid dysgenesis. In exam hall, if you start guessing, imagining, throwing intelligent guesses, stone pelting, nothing will help. These are all like a Examiner will be like a visa officer in American embassy. Do you know what is most common cause of congenital hypothyroidism? Yes, sir. It is thyroid disgenesis. Clear. Why did you come to this country, sir? To have I want to watch your Amazon forest, your rivers. That's all, sir. Not for job, sir. Yeah, go. Like that. Precision is the king of the competition. The more precise you become, the more sure you become, the more involuntarily you are able to checkmark the answers. That is the day where you are going to make to the top rank in the NEET PG and FMGE is what you need to remember. The most common causative organism for the sepsis in the newborn, Klebsiella pneumonia. There is no logic, there is no reasoning, nothing in this most common kind of questions. They are all like the gun on your temple and you are being hijacked at the gunpoint. You have to give only correct answer and correct answer only. Now, doctor, a newborn of 7 days old presented with meningitis. What is the most common cause? E. coli. So group B Streptococcus is the most common cause of neonatal meningitis. But recently, E. coli has become the most common pathogen, especially in very low bone weight infants who get meningitis is what you need to remember. About pediatric tracheostomy. The most common early complication is subcutaneous emphysema. Is true. It is the third or fourth tracheal ring which is incised. So skin incision is from second to fourth, and moisturing of the audify should be done. It is very difficult to extubate tracheostomy tube in pediatric tracheostomy. So you should not forget, typically the skin markings of the incision site and the midline dissection, and typically the anterior tracheal wall between second and fourth tracheal rings, you will make a vertical incision in pediatric tracheostomy is what you need to remember. Very good to see Vinita, Patna, Pradeep Reddy. Wow. Very good, Pradeep. We had been missing you since long time. Sandeep Reddy, Nagesh, Citizen, and many more. Eruka Naidu, and many more who have joined. Bring some more of your friends. Tell them that youtube.com/onlinembbs is your companion every day. And I'm getting some of the wonderful teachers. We have one Dr. Vamshidhar, who is a cardiothoracic surgeon. He's an excellent teacher, both surgery and radiology. I have Dr. Shailendra sir, who is excellent pharmacology teacher. And Dr. Virendra Kulkarni, he is a professor of pathology in Gulbarga. Wow, you will enjoy his classes. There are some free YouTube videos of him on this channel also. So I told them, please come to YouTube channel and deliver as many sessions that you can freely to the students across the country preparing for the NEET PG and also undergraduate exam, FMGE, USMLE, etc. So they're all volunteered to come and live broadcast on our YouTube channel. But of course, after the session is over, we remove that video and we host it as courses on our INCUS channel, which you need to subscribe. Okay, so that is a whole idea in plan, doctor. Very good. Patna is saying, sir, AIIMS exam is on Thursday. Excellent, doctor. After AIIMS exam is over, once all our students give recalled questions, we will have lagatar discussion. But once more, I want to tell you, AIIMS ho, PGI ho, JIPMER ho, All India ho, NEET PG ho, FMGE ho, these are the issues. Neuroblastomas, leukemias, Wilms tumors, cataracts, glaucomas, retinoblastomas, contraception, 953 high yield topics. You have to give half an hour each, at least 450 hours of your time on the online mbbs.com video library to become the champions for the preparation. Every day you should study 2 to 4 hours with Dr. Murali Bharadwaj. If you promise that at least for 6 months you are consistently studying, that is the secret formula to be in the top 1000 ranks. Very good. Eruka Naidu is saying JIPMER exam is on 21st June. Definitely. Already we discussed JIPMER questions, doctor. They're all available in the online mbbs.com video library. Please take a chance to subscribe. Now, neuroblastoma is a tumor of autonomic nervous system, and the most common site is adrenal medulla. Acute gastroenteritis in children. Salmonella is most common cause. It may be fatal if it is not treated on time. It can lead to lactose intolerance. Very important. After gastroenteritis, the children become lactose intolerant. That's the reason you need to feed them with lactose-free diets, which is very important. The most common cause of acute tracheitis in children, Staphylococcus aureus. Leukocytoclastic vasculitis affecting pediatric population, Henoch-Conlins perfida. Recurrent UTI. Typically, if a girl is having UTI, it is understandable because the anal orifice and the vagina are very close to each other. But a boy with a long urethra, unlikely to have an easy access to the anal canal for the infection to enter. So that is the reason any boy with recurrent UTI, you need to do an IVP and evaluate thoroughly whether he is having any vesico-ureteric reflux is what you need to remember. Epiglottitis, Haemophilus influenza. The most common inherited malignancy is retinoblastoma. The most common cause of renal artery stenosis in children. Come on. Who is going to give the correct answer will get a laddu on WhatsApp. Come on. Punch your answers, doctor. I'll just get a bottle of water. Keep punching your answers for this question. So, doctor, very good. Nagesh is proposing fibromedial hypertrophy. I thought. Nagesh, clean bold. Chetan, clean bold. Sandeep, clean bold. Ritu, clean bold. Pramod Gurjar, Jindabad. Takayasu's aortoarteritis. So you should remember, aortoarteritis is the commonest cause of renal artery stenosis in India. How is the Yorker? Renovascular hypertension is the second most common cause of correctable secondary hypertension in children, is what you need to remember. And in the Western literature, the commonest cause of renovascular hypertension in children is fibromuscular dysplasia, Western literature. Whereas in India, it is Takayasu's disease, which is the most common cause, accounting up to 87% of children who have renovascular disease, is what you need to remember. The most common cause of renal artery stenosis in India is Takayasu arthritis. Neonatal sepsis in hospital. The most common cause is Klebsiella. The data from Neonatal Perinatal Database 2000 itself suggests Klebsiella pneumoniae, Staphylococcus aureus. The two most common causes which you need to remember. The most common inherited childhood tumor is retinoblastoma, such a repeatedly asked question in AIIMS. The most common cause of seizure in the newborn is hypoxic ischemic encephalopathy, is the most common if the newborn is having seizures. Congenital rubella. What is the true statement about congenital rubella? Keep punching the answers, doctor. See, this is more an interactive session. आप जितना खेल सकते उतना खेलना, और हम आपको, we will make you play. You should get charged with energy, like Eruku Naidu is blasting the chat with D, only D. Absolutely right. Very good. Eruku Naidu, you are from which part of the country, doctor? So, increased risk of congenital malformation to the infection is there only if it happened at the time of organogenesis before 16 weeks, is what you need to remember. Very good. Which part of Andhra, Eruku? The most common sequelae due to periventricular leukomalacia. It leads to development of spastic diplegia. So this is this is the typical periventricular leukomalacia, means typically leuko means white matter involvement. Very good, from Visakhapatnam. So Dr. Ravi Kiran, who is one of our star orthopedic teacher, he is also from Visakhapatnam. He is a very passionate teacher, and I am so happy while watching his live broadcasted sessions on our YouTube channel. So I'm going to get Dr. Apeksha Sharma. She is an excellent obstetrics teacher. We also have one Dr. Shilpa Reddy. Wow. Very mesmerizing teacher. The kind of explanation, the way she drives the content into your mind, evoking your intellectual curiosity, the ability to make others interested in learning, that is a gifted talent given by the Almighty. All of us are teachers. We have something to contribute to teach others before we pass away. So that's the reason You need to remember to, while you go to reading room, library, wherever you are studying for entrance exam, don't study in isolation. Have a group of people with you, right? Have fun in learning. Go to movies together, right? Enjoy shuttle, table tennis, carom board, football, cricket, and once more come back and sit and study. 6 months, think that it is a God-given gift for you. The NEET PGE preparation time is such a sweet time, never comes in life. After that, life is all about running race. Throughout life, we are only doing running race. Okay, doctor? Now, doctor, the most common cause of sepsis in India within 2 months after birth. You should remember coagulase positive Staphylococcus aureus. There was one small mistake in most commons in my last session. I have delivered 350 most commons in surgery. It was an error of omission. So the most common quadrant of the breast where you find breast carcinoma is typically the left breast, upper outer quadrant. By mistake, I told you lower quadrant, but lower outer quadrant I said, but it is upper outer quadrant. Small correction. One of the students nicely mentioned it in the reviews. So, what is the definition of early onset sepsis, doctor? The one which started within the first 3 days of life. Typically, it is caused by E. coli or group B Streptococcus. Late onset sepsis hota hai from day 4 to day 30. And most often it is the gram-positive organisms. Quite often, the neonatal sepsis initial presentation is often subtle. So that is the reason, even before culture results come, you should start antibiotics. So the early onset neonatal sepsis of the preterm infants together is group B Streptococcus and E. coli, which account for 70% of infections. And the late onset nosocomial sepsis in the neonatal period, especially in the very low birth weight babies, both Staph aureus, including community-associated MRSA, and coagulase negative staphylococci, they are the most frequent causes of the late onset sepsis, is what you have to remember. Now, doctor, the most common organism associated with cystic fibrosis, Pseudomonas aeruginosa, congenital rubella. Congenital rubella, as we discussed, the immunoglobulin G will persist more than 6 months because it comes from mother. IgM is present at birth if at all infection occurs. The most common anomalies are hearing and heart defects. Now, the most common organism causing neonatal sepsis, Klebsiella. The most common candidal species affecting the neonates from the caregiver's hand, typically it is Candida albicans. So invasive candidiasis can lead to mortality, very high mortality. And typically the mortality will be as high as 50% in very low birth weight neonates. And the most common species isolated in the newborn neonates is Candida albicans. Once more, I want to tell all of you, doctor, we have a 64 full-scale NEET PG grant test. NEET PG grant test available on the onlinembbs.com. Every Sunday, April to November 30, there are 35 tests conducted. 35 Sundays, 35 tests. December 1st to December 31st. Every day one test is conducted. Morning test, evening discussion. So totally 65 tests, 300 MCQ wala will chisel you. So today also there is a test morning hosted in the package. So please call our helpline 9000-868-356 and subscribe at a throwaway price. And tomorrow morning I will discuss today's Sunday question paper. Okay? So once you are being challenged, out of 300, how many marks you are getting, what topics you are going wrong, right, which subjects you are doing better. Once you get that analysis, every week is like preparing for a world war, right? So the most common cause, Pradeep Reddy gives a very good point. Malassezia loves lipids. So when premature babies are given lipids, there is a high risk of fungemia from furfur. Malassezia furfur. Beautiful. Good point. The most common cause of the portal hypertension in children. Come on. Who is going to give me the correct answer for this question, doctor? Should be the perfect answer. What is the correct answer for this question? So Pavan Verma is proposing Bud Cheery. Pavan, clean bowl. Naresh Kumar, clean bowl. Sunny Sandeep, Jindabad. Extrahepatic portal vein obstruction. So the prehepatic blockages are most common cause of portal hypertension in children. Most commonly identified pediatric portal hypertension is caused by extrahepatic portal vein obstruction. एक गर्मा गर्म point मिल गए, बढ़िया. So spending with Dr. Murali Bharadwaj every day 2 hours is going to 6 months. At least 100 days, if you are able to spend with Dr. Murli, I say garma garam points bahut add ho jayega aapke medical lexicon ko, and you are sure to win, right? So that's my promise to all of you. The most common presentation of neuroblastoma. It can present with lytic lesions in the skull with suture diastasis actually, not diastasis, diastasis. The most common cause of pyogenic meningitis between 6 months to 2 years of age is H. influenza. So you should know, doctor, based upon the age group, what is the cause of bacterial meningitis? Pediatrics bole to it is no different from pathology, general medicine. You have to be confident and 100% sure about this story. Neonates, group B or group D streptococci, E. coli, listeria. Infants and children, H. influenza 48%, Streptococcus pneumoniae 13% and Neisseria. Adults, Streptococcus pneumoniae 30 to 50%. Excellent. So Pradeep Reddy, like classmates, are the real catalyst for us to get the top rank, doctor. Let me tell you. I'm not flattering you, Pradeep. So, Baby Bell, you remember, Baby Bell. What is Bell? B for group B Streptococcus, E for E. coli, L for Listeria. अरे वाह क्या मजा आ गया. Now, the most common cause of hydrocephalus in children, what is it? So actually we are now building a, Eruka is asking, sir, why don't you conduct quiz like Kahoot? Kahoot quizzes will conduct down the line. Currently, we are building a portal just like Facebook. Facebook for only education, learning. So, still it is in the beta version. Beta version. 1 minute, doctor. One minute. Yeah. So now we are coming up with this very interesting website called incus.live. This is similar to Facebook. Still, it is in the beta version. There are a few more technical glitches. By afternoon, we will finish it so that it will be available for all of you. So it will have the photos, videos, groups, forums, events, chat between the members, and the news feed. Everything will be available. And just like Facebook, it has got all the features like Facebook for learning, basically. So once it is released, this is only a pre-release declaration. By tomorrow morning, it will be ready. So once this is available, you can make friends with other aspirants. You can share their notes. Many more things that you can be able to do. Incus.live. Incus.live. Tomorrow morning, it will become available where you can be able to sign in into this something which is like a Facebook for learning. It can be for MBBS exams, any exams. This is also the place where you can discover mentors with whom you can get a real-time counseling. And I'm going to ask 1,000 first 1,000 rankers in NEET PG 2020. I'm trying to trace where they are located. I'm trying to get them to become the counselors, mentors on the incus.live forum. And I also love to live interview them and broadcast it onto YouTube about their story. How much insecure they were feeling in November, last year, November, before going to exam. And what is their honest advice? It's not like I took your coaching, I got the seat, not that paid commercial things. Anyone will get the seat by their own hard work and preparation. There's no doubt about it. Of course, there are some great teachers in this country, in this world, who will add a little bit of spark and petrol to your energy levels, and they will not let you to fall down. But otherwise, it is your war, it is your game that you need to play. So I want to do some sort of Oprah Winfrey-like shows, of talk shows with the top rankers. How was their MBBS days, and how was their journey last year, and how they are able to make it into the top 1,000. There are no super secrets. Only thing is, one formula does not fit everybody. But there are at least some 10 formulas, not more than that, that can fit most of the people. But we need to know what is the formula. What is the formula that made somebody to be into the top 1,000 ranks? Can I subscribe to that formula of the topper? So that is the whole idea. So today, all this Zoom, everything is all these Zoom, YouTube broadcasts, everything have made connecting people become more easier. So, doctor, the most common cause of the hydrocephalus in children is post-inflammatory obstruction. If there is a meningitis will cause aqueductal stenosis. It can lead to arachnoid fibrosis. That can lead to stagnation of the flow of the CSF, is what you need to remember. What is true about coarctation of aorta? Coarctation of the aorta. The most common site is distal to the origin of the left subclavian artery, is what you need to remember. So coarctation is more common in males. It based upon whether it is pre or post-ductal. But mostly constriction lies distal to the origin of the subclavian artery opposite the ductus arteriosus. That's the reason it is called juxtaductal. Juxtaductal is most common. Preductal is less common, where the narrowing is proximal to the ductus arteriosus. The most common malignancy in children is lymphomas and leukemias. The brain tumors in children, mostly they are infratentorial in pediatric, supratentorial in adult. Please don't forget. So, what are supratentorial tumors? Supracellular, like chiasmal gliomas, craniopharyngiomas. They can be hemispheric, like low-grade and high-grade astrocytomas, and pinealomas. Infratentorial, 75% are in cerebellum and fourth ventricle, and in posterior fossa, you have medulloblastoma, astrocytoma, brainstem glioma, and ependymoma. These infratentorial tumors are the most common in case of children, like this. Supratentorial are most common in the adults. Please don't forget, doctor. The most common cause of urinary obstruction in male infant is posterior urethral valve. The most common cause of meningitis between 6 months to 2 years, H. influenza. The most common cause of liver disease in children is alpha-1 antitrypsin deficiency. Ambiguous genitalia in newborn is because of the excess androgens that happen because of the 21 alpha hydroxylase deficiency. If you have gone this question wrong, doctor, please don't forget to go back to the online mbbs.com video library and do the revision of congenital adrenal hyperplasia, the most favorite topic of the examiner. Biochemistry, general medicine, pediatrics, sare jaga, it is the most high-yield topic. One question in 300 questions. It is a very high-risk topic. Now, doctor, the common cause of abdominal mass in the neonates, multicystic dysplastic kidneys. The most common agent, neonatal bacterial meningitis, group B Streptococcus, Streptococcus agalactiae. The most common leukocytoclastic vasculitis is Henoch-Schönlein. The most common type of total anomalous pulmonary venous. What is anomalous pulmonary venous connection? Left atrium, left ventricle, right atrium, right ventricle. Where will SVC, IVC, they all drain into? The right atrium pulmonary vein is supposed to drain into left atrium. But what will pulmonary vein will do in TAPVC, total anomalous pulmonary venous circulation? The left pulmonary vein, right pulmonary vein together will form common pulmonary vein and drain, instead of into left atrium, it will drain into right atrium. And that is the problem of TAPVC. But this can happen, this common pulmonary vein can drain into SVC, or it can drain into IVC, or directly into right atrium. One of the three possibilities. Accordingly, you have supracardiac, means common pulmonary vein is draining into SVC. Infracardiac, common pulmonary vein is draining into IVC. And cardiac, directly into right atrium. Accordingly, you have three types of total anomalous pulmonary venous circulation. Of all the three, what is most common type? Supracardiac is most common type. Is what you need to remember. There is a darling classification. Type 1 is called supracardiac, 45% of cases, where right and left pulmonary veins join to form common pulmonary vein, which will typically go and join into the left innominate vein and then into right atrium. Whereas cardiac means the two pulmonary veins join to form common pulmonary vein, and that drains into coronary sinus and then into right atrium. So now, what is the most common renal cystic disease in infants? Unilateral renal dysplasia. Wherever we have 45 online students, I hope you are all receiving the notification whenever we are starting the class. To receive that notification, either you should be at least in our WhatsApp group or Telegram group, or at least the bell sign of this YouTube channel. You should subscribe to the channel and click on the bell sign. Best thing is be part of our Telegram group and WhatsApp group. You will definitely receive notification. In order to get included yourself into our groups, 9000-868-356, our helpline. So please take a chance to call and get included. The most common cause of renal scarring in a 3-year-old child is a vesico-ureteric reflux-induced pyelonephritis will be responsible. The most common presentation of child with Wilms tumor is asymptomatic abdominal mass while the mother is giving bath to the child. The most common malignant neoplasm of the infancy is neuroblastoma. Acute bronchiolitis, what is the most common cause? Respiratory syncytial virus. The most common tumor in the children is leukemia. The most common mode of treatment in a 1-year-old child with asthma is you will give beta 2 agonist, which is short acting in nature, like salbutamol. The most common treatment of a 1-year-old child with asthma, you should remember SABA, short acting beta 2 agonistic agent. 1-year-old child, most common organism causing meningitis. Typically Streptococcus pneumoniae. The most common cause of short stature. Chotu hota hai constitutional. They are late bloomers. The shortest boy in class 8 becomes tallest boy by the time he is in class 12. Right? So be very sure. Late bloomers are constitutional, which is most common cause of short stature. Coarctation of aorta is often associated with PDA, patent ductus arteriosus. Now, regarding Kawasaki disease, you should remember it is associated with coronary artery aneurysm in up to 25% of untreated cases. But one point you should remember is, you don't give IV immunoglobulins when acutely coronary artery is involved. IV immunoglobulins are indicated for a prophylactic use to prevent the development of the coronary aneurysm, not for acute treatment. So what are all the FDA approved indications for the IV immunoglobulins, doctor? Please don't forget this very, very important list, which is favorite question of the examiner. Primary immunodeficiencies, you will give IV immunoglobulin. IV immunoglobulin. If there is hypogammaglobulinemia with recurrent infection, B-cell CLL, IV immunoglobulin. To prevent, not acutely to treat, to prevent coronary artery aneurysm in Kawasaki disease. To prevent infections, pneumonia, and acute graft versus host disease after bone marrow transplantation, IV immunoglobulin. To reduce serious infections in children with HIV, IV immunoglobulin. To increase the platelet count in ITP to prevent or control the bleeding, we give IV immunoglobulin is what you need to remember. अभी एक गर्मा गर्म क्वेश्चन आ गया, सुपर डुपर क्वेश्चन. आप सब लोग थर्सडे को एम्स लिख रहे हैं ना? एम्स एग्जाम में अगर कंजेनाइटल एड्रेनल हाइपरप्लेसिया का क्वेश्चन नहीं है तो 200 क्वेश्चंस में मेरा नाम मुरली भरद्वाज नहीं है, नहीं होगा. ठीक है? उतना कॉन्फिडेंस के साथ मैं बोल रहा हूं, definitely आएगा. So doctor, in the online mbbs.com video library, there's a beautiful review lecture, 28 minutes review lecture on CAH, congenital adrenal hyperplasia. Please take an opportunity to do the revision. So doctor, the most common cause of CAH, 21 alpha hydroxylase, because there is an excess of androgens, adrenal androgens, the affected females will show clitoromegaly and ambiguous genitalia, and the affected males will show precocious puberty with a enlarged penis in a newborn baby. But 21 alpha hydroxylase deficiency, there is a mineralocorticoid deficiency and excess of androgen. If mineralocorticoid is not there, if aldosterone is not there, Normally, what does aldosterone does, doctor? Aldosterone क्या करेगा? It will come to the distal convoluted tubule. It will cause retention of sodium and loss of K plus H plus into urine. That is a normal function of aldosterone. If aldosterone is not there, then potassium is retained, H plus is retained, Na plus is lost. So that is the reason 21 alpha hydroxylase is called salt-losing CAH. In them, the excess potassium retention lead to hyperkalemia, not alkalosis. H plus ion retention lead to acidosis. That is what you need to remember. Excellent. 50 online classmates. Abhi maza aayega. I'm going to give you 150 most commons in pediatrics in 5 exams together. JIPMER, AIIMS, PGI, DNB, All India, NEET PG, FMGE. Okay? So sit tight, enjoy like poppins each of these most commons, and be confident for the tomorrow's exam. And totally all 19 subjects together, there are about 5,000 most commons. खेलते खेलते हम revision करेंगे सब साथी मिलके. So doctor, you should remember that mineralocorticoid deficiency with aldosterone, with androgen excess, that is the combination in 21 alpha hydroxylase. Symptomatic neonatal CNS involvement is typically a feature of rubella and HSV. Which congenital intrauterine infection? CNS involvement, very common, CMV and toxo. The most common fetal response to acute hypoxia hota hai bradycardia. Neuroblastoma, more than 50% present with metastasis at the time of diagnosis. The most common extracranial solid tumor in the abdomen, neuroblastoma. Most common extracranial solid tumor in childhood, neuroblastoma. Like a parrot, you must answer in the tomorrow's exam, doctor. Often the neuroblastoma will encase the aorta and its branches. Lung mets are rare. The most common metastasis of the neuroblastoma are to the bone marrow. Whereas lung metastases are distinctly uncommon finding in metastatic, neuroblastoma is what you need to remember. What is the most common cause of meningoencephalitis in children? Enterovirus. Recurrent meningitis due to CSF leaks is due to pneumococci. The most common tumor in neurofibromatosis 1 is juvenile myelomonocytic leukemia, JMML, Jharkhand Mukti Morcha leukemia, right? So JMM leukemia. Now, the most common cause of meningoencephalitis in children, enterovirus. The most bacterial cause of diarrhea in children, bacterial, enterotoxigenic E. coli. कभी कभी एग्जाम हॉल में गेस करने की कोशिश करें तो मर जाएंगे. What is the most common tumor in the fetus and newborn? If you include fetus, sacrococcygeal teratoma. The most common organ in congenital TB. Some books say lung, some say liver. मुझे माफ करो, मुझे भी मालूम नहीं. But lung, liver. The most common serious lesion in Downs, VSD. The most common cause of persistent hypertension in intrinsic renal disease, chronic pyelonephritis. Coarctation of aorta is often associated with bicuspid aortic valve. The most common intra-abdominal solid tumor in children. अभी चर्चा किया ना, neuroblastoma. The most common meningitis in children aged 5 years is Neisseria. Pons fracture. Children. Christie Atkinson Munch Peterson. What is that called? CAMP test. Christie Atkinson Munch Peterson. I still remember during my MBBS days, Viva was my examiner asked, do you know what is CAMP? I don't know what is CAMP, sir, but at 20 years of age with high testosterone, I know very well how to camp with my girlfriend. So, kuch examiners cynical रहता. The kind of questions they will ask for fun, but they will pass. Examiners are all very light-hearted fellows. Once upon a time, they used to be very cruel fellows. थोड़ा बेबिंस्की इधर उधर हिल गया तो फेल करके जाता. आजकल तो कोई भी नहीं करेगा वैसा. Most of them, they'll pass the students in Viva. Christie Atkinson Munch Peterson. हाँ, 4 बंदे मिलके एक टेस्ट को डिस्कवर किया. So, CAMP test is positive for Streptococcus agalactiaceae, but negative for Streptococcus pyogenes. So, what is CAMP test? This Streptococcus agalactiaceae produce a CAMP factor. CAMP factor होता है diffuse extracellular protein that will synergistically act with the beta lysine of a Staph aureus, and it will enhance the lysis of the RBCs. That's what you need to remember. The most common pulmonary tumor in children, carcinoid. Very difficult to guess in exam hall. So the primary lung tumors in pediatric age group are extremely there. They contain carcinoid tumors 40%, bronchogenic carcinoma 17%, pleuropulmonary blastoma 15% is what you need to remember. Down's syndrome is most commonly associated with ASD with ostium primum. Most common cause of neonatal meningitis, E. coli. The AV canal defect, the most common syndrome associated is Down's. Wilms tumor is the most common malignant tumor of the kidney. Please don't confuse. Seen in childhood. 57% of abdominal masses in children are due to organomegaly. Basically, hepatomegaly, splenomegaly. Most abdominal masses in the children, infants, arise from kidney. They are benign. But Wilms tumor is the most common malignant tumor of the kidney, which is seen in the childhood, is what you need to remember. So this is how radiologically Wilms tumor, this is neuroblastoma. Typically, neuroblastoma will be forming a case around the aorta, radiologically, right? So how do you approach a abdominal mass? There's a big story. I leave this PowerPoint in the online mbbs.com video library. If you have time, energy, just go through the algorithm. Tomorrow when you become pediatrician, when you become radiologist, you have to run this algorithm here. So neuroblastoma, what is the story of it? The most common extracranial solid tumor of the infant and children, if they ask, the answer is neuroblastoma. But if they ask the question, the most common malignant tumor of the kidney seen in childhood means Wilms tumor. There's a little difference between the two. You have to be very sure about. The most common presentation of Down's cognitive impairment. The most common cause of infectious croup is parainfluenza. The most common cause of parrectal bleeding in infant is anal fissure. The most common anomaly of the upper urogenital tract is PUJ obstruction. Pelvic-ureteric junction stenosis is the most common. The most common organism leading to neonatal meningitis is E. coli. The most common GI malignancy of the childhood hota hai lymphoma. What type of lymphoma? Non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma. Once more, I want to tell you, doctor, by tomorrow morning, we will be starting incus.live, which is like a Facebook for all exam preparation. It's a community. You can put posts, you can put upload relevant videos. You can also upload handwritten notes. You can make friends, you can poke friends, you can say hi to friends. You can get well interconnected, right? So by tomorrow morning, we are up and live with incus.live. So I will also post a lot of quizzes, polls, etc. in incus.live. Take a chance to make friends and build a community. Let us build a community. And also I'm going to bring a lot of toppers. One more thing, one more very good idea. 1.5 million 12th class kids take the NEET UG MBBS entrance. I asked a question to one of my doctor friend. If you want your son to be joining medical college, who is the best mentor for him? Option A, his father who is a doctor. Option B, some coaching center में physics or chemistry teacher. Option C, a दूर के रिश्तेदार, his uncle who is a doctor or some inspiring personality in the family. Or option D, one of our NEET preparing MBBS students who already cracked their NEET UG. Everybody said, if it is one of the MBBS students who can become mentor for a 12th class, 10th class, 9th class student, handhold him what to read and how to crack. Wow, that is the best thing that we can do. So that is the reason, in order to connect the mentors and the people who love to be mentored, seekers of advice. To connect the two, we created this platform called incus.live. We also have a marketplace platform called incus.online. So if you want to become a mentor, what type of people do you like to mentor, right? You can sign up on incus.online and say that, hey, I want to mentor a medical student, MBBS exam going student, or maybe a student preparing for his MBBS exams because I'm in final year. I know what to read, what to not read for a first year student, right? So you can be able to mention and list a course, and you can make it free or you can even charge for that. No worries. So it is like a marketplace, incus.online. Take a chance to have a look at it and subscribe yourself and start mentoring everybody. That's very important. Now, doctor, The most common site of extrapulmonary TB होता है in children, lymph node. Hydroxylase deficiency, what is wrong statement? Typically, 21 alpha hydroxylase deficiency is autosomal recessive. It can lead to female pseudohermaphroditism because the adrenal androgens increase in a female, that will lead to clitoromegaly, and hence female pseudohermaphroditism can occur. In a male child, it leads to precocious puberty. And the most common cause of congenital adrenal hyperplasia is 21 hydroxylase. भैया अभी मैं एक ट्रेड सीक्रेट बताता हूं आपको about congenital adrenal hyperplasia. Which type of congenital adrenal hyperplasias? You have high mineralocorticoid, high testosterone. One of the other questions, I will give you one classical mnemonic for you to remember. Earlier also we discussed many times. The most common cardiovascular abnormality in Down syndrome होता है endocardial cushion defect. The most common conotruncal anomaly is transposition of great vessels. The most common cause of lower respiratory tract infection in 3-year-old is streptococcal pneumonia. Febrile seizure. Febrile seizure doesn't occur before 6 months, but commonly between 6 months to 5 years. Because for a febrile seizure to occur, you need to have the myelination complete. So that is the reason before 6 months you don't get, but 6 months to 5 years. The most common intra-abdominal solid organ tumor होता है neuroblastoma. Neuroblastoma. The most common malignancy in children, ALL. The most common ASD is ostium secundum. The most common ASD in Down syndrome is primum. बराबर? अब इस समझ में आ गए ना? The most common presentation of Wills tumor is like an asymptomatic abdominal mass. The most common cardiac defect in Turner syndrome. Who is going to give me the correct answer? Most common cardiac disease defect in Turner syndrome. Come on, punch your answers, doctor. Punch your answers. Very good. Educa is proposing coactation. Sandeep VSD. Naresh is proposing coactation of aorta. The most common cause of acquired heart disease in children, acute rheumatic fever. The most common cardiac lesion in Downs, atrioventricular septal defect. The most common cause of death in Klinefelter. Always if infection is in the options, infection is the answer. No doubt about it. The most common cardiac anomaly in Turner's. So, if you have bicuspid aortic valve in the options, okay, if the bicuspid aortic valve is there, that is much more common than coactation of aorta. Because 16% cases it is bicuspid aortic valve. 11% cases in most of the studies is coactation of aorta. So that is the point you need to appreciate. Most common cause of seizure in the newborn on the day 1 is hypoxic ischemic encephalopathy. Adrenogenital syndrome is most commonly because of 21 alpha hydroxylase. The most common cause of congenital adrenal hyperplasia is 21 alpha hydroxylase. Childhood hypertension. See, 21 alpha hydroxylase is mineralocorticoid deficiency. Whereas 11 beta hydroxylase is excess mineralocorticoid. That lead to development of hypertension. So be very sure on this topic of congenital adrenal hyperplasia. अभी मैं आपको एक सुपर डुपर निमोनिक के पास लेके जाता हूं. 21 alpha hydroxylase, 17 alpha hydroxylase, 11 alpha hydroxylase. They are the three enzymes which lead to development of congenital adrenal hyperplasia. There are two possibilities. Typically, either testosterone is elevated or aldosterone is elevated or aldosterone is decreased. So how will you remember which of these three possibilities in each of these congenital adrenal hyperplasias? So you write the number 21, 17, 11. Wherever 1 is there, testosterone is elevated. Wherever 1 is there, testosterone is elevated. 21 may, wherever 1 is there, that is elevated. So you write A, T, cat. So 21 may, 1 is coming under T. So testosterone is elevated. Testosterone is elevated, but mineralocorticoid is decreased. 17 may, 1 is coming in adrenal position. I mean A position. So that is mineralocorticoid is elevated, but testosterone is decreased. Whereas 11, both aldosterone is elevated, testosterone is also elevated, so they present with hypertension, plus if it is a female child, virilization. बराबर? गर्मा गर्म है ना? A mnemonic? बढ़िया. You should not forget. Okay? Once more, I will repeat. Exam may you need to remember each of these three types of congenital adrenal hyperplasias may is aldosterone elevated or testosterone elevated. How will you know? If you write 21, 1 is coming under testosterone. So testosterone is elevated, aldosterone decreased. 17, 1 is coming in aldosterone position. So aldosterone elevated, testosterone decreased. 11 may both 1 is coming in aldosterone and testosterone. So both aldosterone elevated and also testosterone elevated. So both hypertension and virilization. बराबर? फुटबॉल ले लिया ना? हाँ. So the most common cause of neonatal meningitis is Streptococcus group B. The most common location of supernumerary teeth is between the incisors. The most common age for pediatric TB, 1 to 4 years. The most common age group of bronchiolitis, less than 2 years. The most common cause of bronchiolitis, respiratory syncytial virus. The most common cause of pneumonia in children overall is viral, that is respiratory syncytial. About Wilms tumor. Hematuria is the presenting symptom, presents as abdominal mass. I think there are option D also. Garvad hai. So we'll come back to this question. Now, the question frame was not correct. Now, the most common cause of acute infantile gastroenteritis is rotavirus. The most common cause of diarrhea in infants is viral. The most common bacterial cause of diarrhea in children, enterotoxigenic E. coli. The most common cause of first-day jaundice is erythroblastosis fetalis. So, doctor, any jaundice appearing within 24 hours, what are the causes? Hemolytic disease like RH incompatibility, ABO incompatibility, Torch group of infections, malaria, bacterial infections, G6PD deficiency, thalassemia, spherocytosis. 5 causes within 24 hours. 24 to 72 hours can be physiological sepsis, polycythemia, intraventricular hemorrhage, and increased enterohepatic circulation. So what is the most common GI malignancy of the childhood? So just before we discuss. Non-Hodgkin's lymphoma. The most common cause of GI obstruction in children is pyloric stenosis. This is a FMGE question. The most common cause of acute epiglottitis in children. Acute epiglottitis is bacterial and it can lead to mortality if you don't intervene. But laryngotracheobronchitis cru is viral, parainfluenza. There's a difference. The most common cause of sore throat in children is a common cold causing. What is the most common cold causing virus? Rhinovirus. The most common cause. The most common cause of the fetal ventriculomegaly is the aqueductal stenosis. The most common viral cause of acquired aqueductal stenosis is mumps. The most common cause of UTI in children less than 5 years is E. coli. The most common cause of constipation in children, habitual. Double aortic arch in infants can lead to the compression of the trachea. Typically, it leads to tracheal compression symptoms. The most common birth defect in North India, neural tube defects, like spina bifida. The most common cause of death in PDA, patent ductus arteriosus. Typically, PDA will lead to a high output cardiac failure. So CHF. The most common cause of upper GI bleed in children is acute gastritis. The most common thyroid tumor children are adults, papillary tumor. The most common cause of short stature is constitutional. Pathological jaundice on the first day of life is RH incompatibility. The most common neonatal mortality in India, prematurity, is what? Like a parrot you should answer. Keep punching answers, doctor. My job is to run as fast as possible. 1.5 hours, 150 questions. That is our run rate. Okay? So, if somebody said, you should have intelligence to become topper, nonsense. It is not an exam of intelligence at all. It is the exam of Fevicol. Fevicol लगाओ reading room में बैठ जाओ कुर्सी पर कहीं भी नहीं जाना. Perseverance, persistence will make you to win, whether you are proposing to a girl or whether you are winning NEET PG. Right? Be persistent, be focused, laser focused. 953 high yield topics. Numerics to remember, you have to mug, there is no choice. List to remember, P415 users, P415 inhibitors, blah, 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 blah. You have to. Logical points that you should master. Why diabetes insipidus is a diuretic condition, still the treatment of choice is thiazide diuretic, which is a diuretic. Logical reasoning. Nephrocalcinosis RTA type 1 में होता या type 2 में होता. Logical reasoning. ये सब आपको मिलेगा onlinembbs.com video library में. Attend every day. I'm bringing 150 teachers to be your mentors, to handhold you, to make you to become winners. And I'm also going behind first 1,000 rankers of last year. Beg, borrow, steal, or hijack them, and then bring them as the mentors on the Incus.live to be with you, to be your advisors, and make you to win. Okay, doctor? Now, post-term baby presented with tachypnea. So please don't forget, doctor, every Sunday we have a full-scale grant test. I want all of you to subscribe to onlinembbs.com. 65 full-scale grant tests. Every Sunday religiously you should take the test. And on Monday, I will discuss the question paper. And December 1st to December 31st, every day, morning test, evening discussion, morning test, evening discussion. Okay, doctor? Now, Pradeep is adding a very good point. You see, one is stones. Wow. I'm a big fan of Pradeep Reddy. One is stones. Renal tubular acidosis type 1 is the place where you find stones. Because in type 1 RTA, which is distal renal tubular acidosis, it leads to high urine pH. So there is an increased risk of phosphate kind of stones. Beautiful, Pradeep. Super duper. So Pradeep, you should also join in the incus.live and give me a promise that you will contribute a lot with handwritten notes, mnemonics, some easy ways to remember, etc., etc. So, doctor, post-term baby, not preterm, post-term baby presented with tachypnea is meconium aspiration. If it were to be preterm, think of hyaline membrane disease. What is the most common deficiency? It is 21-alpha hydroxylase. The most common cause of death in aortic stenosis. Typically, aortic stenosis lead to the left ventricular hypertrophy, which will typically lead to ischemic heart disease and ventricular fibrillation. The most common type of cyanotic heart disease. What are the 4 T's that you will remember? T for tricuspid atresia, T for transposition of great arteries, T for tetralogy of Fallot, T for truncus arteriosus. Of all these T's, it is a tetralogy of Fallot, the most common cause for the type of cyanotic heart disease is what you need to remember. The most common presentation of neonatal meningitis. It is poor feeding. Poor feeding. The most common etiological agent of acute bronchiolitis is respiratory syncytial virus. UTI in children less than 5 years is E. coli. The most common malignancy of childhood is ALL. And the most common presentation of neonatal meningitis, poor feeding, and the most common cause of nephrotic syndrome in children is minimal change disease, is what you need to remember. So, doctor, Shanti, Shanti, Shanti. Today, we are able to finish the list of 115 yearly most commons in pediatrics from AIIMS, All India, PGI, DNB, JIPMER, and FMGE. A lot of repeated questions are there. We removed all of them. So this is one algorithmic way of doing revision. So there are totally 5,000 most commons. If you combine all 19 subjects, I can guarantee you at least 20-30 questions of most commons from this 5,000 list is going to come in your 300 MCQs in the tomorrow's NEET PG. Okay, so if you want this PowerPoint, please take every opportunity to subscribe to the onlinembbs.com video library. Once more, tomorrow we will all meet up with the discussion of today's Sunday's full-scale grand test question paper. Before that, you please answer and be ready with pen and paper to join a high adrenaline revision of test and discussion with Dr. Murali Bharadwaj. Enjoy a great evening. Thank you very much.